The behavioral health landscape when I came to Georgia in 1986 was most like many other
I
states.
think the word that comes to mind to me is siloed. Everybody kind of had their rules and policies as everybody has, and they kind of stayed in their lane, and a lot of folks didn't cross over to that. Not to say there wasn't good work being done back in those days, but I think that was the best work that they thought they could do at that time.
Well, Georgia has attempted some variation of the system of care for a lot of years, with more or less success. Some were incredibly good, and some were not. And some outlasted a few years, and some didn't. KidsNet, Champs, Fulton County, Nothing About Us Without Us, Families as Allies. Their different pieces have come out over the years, and they more or less addressed the array of things that are now being addressed, but they were mainly one agency, or two at best. They were not the huge collaborative of both mental and physical health that we are seeing now.
So KidsNet became really, there was a lot of work invested in building a system of care, getting people to the same table, talking, and let's invite families this time. To this day, Georgia still does a System of Care Academy every year, every summer. KidsNet was the one that kicked that off. So I think you had those precursors to building this was really part of that foundation.
We were one of the first 10 states in Georgia funded by the Federal Substance Abuse and Mental Health Services Administration Agency for a System of Care grant. And the name of that grant was the Child and Adolescent Service System Program. And the purpose was to develop interagency collaboration mechanisms to build family and youth support and to focus on cultural competence. We really have focused on not only building the interagency mechanisms for collaboration and coordination, building the family movement that we now have in Georgia, building the youth movement. We focused on increasing our service capacity, expanding capacity for services. We focused on how we finance those services. We really have tried and pushed hard to have the community-based services and supports in place so that we could keep children in their communities, in their schools, with their families.
I think, significantly improved and much, in my opinion, much better than the past, 10 years before that. I think we have now a landscape that people come into it, and they're already coming into a foundation. They're already walking into something that's established. You're not having to reinvent the wheel.